So what happened to Kai Chun and Sarah? Are they still there, or they just
A little shy. A little
logged
shy.
in? Are they logged in, or they still left, or still
Yeah,
alive?
they're still there. They're still there. So Sarah is still there. Nikita is still there. Sean, yeah, it's okay. They're a little shy. Later, maybe in a little while. So hello, everyone. Thank you so much for joining us for this panel on careers in healthcare. We have a great panel of mentors today to share their experience in healthcare. We have Dr. Tan, who is a doctor of many years, and as well as Sophie, Arun, and Sanjay, who are the non-medical side. So it's great whether you are from a medical background or looking for other roles in healthcare. And they will be sharing a lot of the experiences of what this field can offer to us. So definitely encourage you to turn on your videos and ask lots of questions of our mentors. They have so much experience, decades and decades of experience that they can share with you. So do take advantage of having them here. So without further ado, I am going to ask our panelists to introduce themselves. I'll start with Dr. Tan and then go to Arun, Sophie, and Sanjay. Okay, so Chiu, if you would like.
Thank you, Adeline. Yeah, my name is Chiu, and it's nice to have you all on this meetup. I am a clinical doctor. I'm a gastroenterologist by profession. I work in Gleneagles Hospital. I run my own practice. But over the years, and I'm sure you're gonna be able to ask me questions about how I did this, I ended up doing all sorts of other things. I've ended up working as a military regular. I'm a veteran of the First Gulf War. I work on a lot of non-profit organizations as board and committee member. I do a lot of international development kind of work, as well as run humanitarian disaster relief missions all over the place. So, broadly, that's my background. Just a quick sketch. And if you need to know more, or if you want to know more, I can share it with you later. Thank you.
Great, fantastic.
It's a very tough act to follow, Dr. Tan. So by reckoning, again, I'm an engineer, MBA. I have my own digital health / MedTech company. It's called Crelly. So prior to starting Crelly about 3 years ago, so I was the chief information officer at Stryker, one of the big MedTech companies in the world. So essentially, I've worked a lot of companies in many industries, automotive, consumer health, pharmaceuticals, life sciences, medical devices. And then my calling came and said, look, I want to do something different. So what we do is we detect, predict infection, surgical infection. So just to give you a perspective, there are about 300 million surgeries that happen every year worldwide. That's about roughly 50 to 60 times the size of Singapore's population. And a fifth of those are large open surgeries, and incidence of infection from the surgical wound is a very common occurrence. So from anywhere from a fraction of a percentage up to 40% in case of emergency surgeries, this is a very common occurrence. So what's the big issue here we're trying to solve? Because infection and healing start same way, and then infection take a different path. And if a clinician looks at it, and that's been happening for the last 2,000 years. The clinician's way of looking at infection is looking, touching, feeling, smelling the wound. And that's pretty much the information the clinician has to detect if an infection is present or not. So obviously, depending on when the clinician looks at the wound, they may have a misleading signal. And also for some people who have a little bit of dark skin or other, the redness may not be spontaneous and people could tolerate pain. Signs of infection may be present, but not visible. The last major issue is time is of the essence in treating infection. So I'm going a little bit of a pitch mode, but I think that gives you a sense of deeper problem, because I'm upfront telling you, because I'm going to have you pepper me with questions. So it comes later, right? The third issue is that sense of time. Between Friday afternoon and Monday morning, for example, a 48-hour delay increases the risk of death by 4 times. So what our mission is to say, our vision is nobody should die due to delayed detection of infection, which means we have a mechanism using a wearable sensors and artificial intelligence where we put on a sensor on the patient's close to the wound, collect some parameters, look at the patterns, predict and detect infection 24 to 48 hours ahead of time. With that information, the clinicians can bring the patient to the office or do whatever necessary. We give them 48 hours advance notice with credible early warning. That information can save lives, improve outcomes. That's pretty much what we do. So I'm going to be talking today about both from my past life, from a big corporate healthcare and medical device exposure, but more from an healthcare entrepreneurship perspective. How you can, Singapore's got a fantastic ecosystem. It's still emerging, but I think for some of you who want to take on an entrepreneurial route, so I'm here.
Fantastic. Thank you so much, Arun. And before I hand it to you, Sophie, so just let everyone know who we have in the room. So about 1/3 of our audience today are in the medical, are pursuing a medical field of study. So can be nursing, can be medical, can be biomedical. Another about 1/3 are pursuing business related studies. And then another 1/3 are pursuing others. So that could be engineering, could be media, could be social sciences. So it's good because we have, not just medical students listening to today. And Arun, as you mentioned, you're on the business side, but also the entrepreneurship side. And then from there, the nice segue to Sophie. So Sophie, can you introduce yourself?
Sure. Thanks, Adeline. So hi, everyone. My name is Sophie. I work squarely in the big corporate sector. So I work for a company called Parkway Pantai. To give a very brief introduction, Parkway Pantai in Singapore is one of the biggest, it is the biggest private healthcare player. So it includes 4 hospitals. The hospital that Dr. Tan is currently working at has a clinic at Gleneagles, Mount Elizabeth Orchard, Mount Elizabeth Novena, as well as Parkway East Hospital. It has a whole chain of clinics as well called Parkway Shenton. It's got a lab, a radiologist. It's even got a college within the group. So it does have almost all the services in a provider space, so healthcare provider space. And my role specifically in the group has kind of rotated and it has changed over the years. So I started off doing a very finance role. So that's mergers and acquisitions, looking at how do we evaluate which businesses we want to buy or which businesses or which joint venture partners we want to work with to enter a new market, to see whether or not do we want to go into Indonesia or Myanmar or Thailand. So evaluating the Southeast Asia region as well. So for a couple of years, my job involved talking to governments within these countries, talking to doctors and players within these countries as well to understand the different landscapes within the Southeast Asia region. Then I moved to a role that is more operational. So operations role within Parkway East Hospital. And that was very different. So that was very much interacting with patients, interacting with the doctors, getting to know the different departments within a hospital, how the operations function. My personal background is completely non-medical, non-clinical. So I covered everything that was non-clinical essentially. And then now I moved to a new role just this year, looking at integration of the group. So earlier on, I mentioned how all the different segments within the group, and my current role is looking at how can we build synergies between all the different entities. How can we help people to talk to each other more so that we can really function as one big group rather than as 10 different entities. So in a nutshell, big corporate and a lot of good, also a lot of challenges that we face.
Great. So for anyone who is interested in a broad-ranging career in corporates, so Sophie is here. So any questions that you have, please do ask her as we go through this hour together. And with that, Sanjay, can I invite you to introduce yourself?
Before I do that, I said, Sophie, I had the chance of enjoying the hospitality of Mount Elizabeth Novena. I spent a night there with a torn calf muscle, so I would say it's even better than any hotel I've been to. So that's most probably a compliment. That is a great place. It's been a long time since I've stayed in the hospital for reasons other than visiting.
Glad to hear that.
As part of the work, yeah, so that's good. So just to introduce myself, my name is Sanjay. I work for a company called Hologic, which is mainly into women's health. So what's my background? Like Arun, I'm an engineer. So you'll find that there's a lot of these engineers who end up in healthcare. Maybe they go do the engineering, then they don't know what to do with it. Or sometimes like me, when I came out during my engineering, my project during my final year was connected to biomedical engineering. So I and my classmates together, we built something called the speech aid for the vocally disabled. So that got me in a way a little connected to the healthcare side. And we'll talk a little more, I'm sure, about it. But as I went into looking out for jobs, and the jobs came looking out for me, there was the first company that came out. It had a great sounding name, which I couldn't pronounce it very well. And at the same time, they were also paying decent. So the company's name was Boehringer Mannheim, which is a German company that later became Roche Diagnostics. The money was also good. So it was not a great motivation to say I really knew where I was going, everything. It's just that the company was sounding good, the money was good, and you get in and you start your career, right? So I started my career as a service engineer. I was installing these big capital equipment in the labs, in hospitals where Sophie works and where Dr. Tan works, right? And from there, very quickly, somebody spotted and said, look, I think you're a better salesperson than an engineer. So why don't you switch your career from service to sales? And that's how I switched my career from service to sales. And then over the years, I've worked for different healthcare companies in the Indian subcontinent, in ASEAN, spent 5 years in China working for large companies. So I worked over the years with Boston Scientific in the interventional cardiology and neurology space, worked with Baxter across the region, used to run Baxter for the entire region here. And 5 years ago, I joined this company called Hologic. So what is Hologic and why did I do that? All the years I've done everything for myself and my career, but it was time that I could see my sunset of my career ahead, as I would call it. And I felt there was something to do, at least for my family. So I have my wife and 2 daughters at home. And that was the first thing I could do, at least the only time I'm doing something very specific for them. So Hologic is into women's health, mainly into the detection of breast cancer and cervical cancer. And we are in a way a bridge between someone like Dr. Tan, who's a physician, Sophie, who's an administrator, and the governments, who are stakeholders, right? So we come in with products and solutions that benefit everyone. And that's part of the ecosystem in which today, as you see this panel, it's an ecosystem where we are all coming together and helping each other. Now, Dr. Tan touches one patient at a time. That's a very deep relationship, a very personal relationship that he develops in his line of work with the patient. But he's able to touch 5, 10, 15, 20 patients a day. What opportunity I get through the work I get is I get to touch maybe hundreds and thousands of people every day, but I don't have an intimacy that he has in his role, right? And clearly there's a satisfaction level that is also very different because he gets to personally feel what it is to make a difference to a person's life or human being's life, right? When you come in the industry, you get a level of satisfaction because you're doing that versus being in tobacco or alcohol or some other industry, right? So there is still a level of intimacy and impact you're making to people's lives, but maybe not as deep and impactful as a physician makes, right? So that's just a way to kind of entice you all to start thinking about a career in healthcare. I've been in healthcare now for almost 30 years. So this is my 31st year in the healthcare side of the business. Okay, over to you, Adeline.
Thank you, Sanjay, so much. And thank you so much for bringing up that aspect of caring for people, right? And feeling the empathy. And that actually gives us a nice segue to go back to Dr. Tan to get you, Dr. Tan.
Adeline.
Oh, hey, Arun, go ahead.
You are an entrepreneur yourself, so you should introduce yourself. So they should know your fantastic story. Come on.
So actually, I am kind of in the healthcare space. I run a digital mental health startup, but I fell into it by accident. So I wouldn't say I have 30 years of experience in healthcare the way that Sanjay or Dr. Tan have. My background actually is in consumer products, most recently with Coke. So Sanjay, when you said tobacco and other industries, I was like, oops, that was one of my past. But I fell into it by accident. It actually was started by my husband because he suffered from mental health issues, and he found this particular type of trauma therapy that worked wonders for him. And so he thought of how could he bring it to more people, make it affordable, make it more accessible. And so he started with that. And then about a year ago, we had gotten to a stage where he needed someone to help him grow it. And I had the business experience to help him do it. So I do have a little bit of experience as an entrepreneur in the mental health space. But I think we have a fantastic panel of mentors here with a lot more experience. So I will let them share their experience. Dr. Tan, if I could go back to you. Maybe you can share a little bit about the different types of clinical roles that you've been in, and what differentiates those roles. What kinds of aptitudes do people looking to do those roles? What would they need to have?
Thanks, Chandelien. That's a very broad question, but it's a very important one. I like to think of medical training as being very deep, but very narrow. Even if you're a general practitioner and you practice a number of different sort of specialties at a superficial level, looking after patients' general problems, it is still nonetheless a set of skills and a sort of a range of knowledge, which is pretty narrow. One of the things I realized about being a medical professional and coming through a professional training program, for example, an MBBS course, or if you like a nursing program or anything else which is professional, is that as you travel down your career path, there is a tendency, if you are very interested, and of course people should be interested in what they do and to develop the competencies, there's a tendency to find yourself going deeper and deeper and deeper into a Grand Canyon of a career experience. Now, there's nothing wrong with this. We all need professionals who are very deeply immersed in what they do, doing their medical or nursing or biochemical or pharmaceutical research. We need people who are at the cutting edge of medical science and at the cutting edge of patient management as well. If not for that, we wouldn't have Sanjay having such a good experience, and you wouldn't have people like me trying to, as it were, look after our patients. But at the same time, your personality has something to do with it. If you are of the right personality, going into this very deep but narrow chasm of a career is very, very satisfying. So people who are deeply immersed in clinical treatment, people who are deeply immersed in research, their lives are ultimately very satisfying, because what they do, as Sanjay says, matters to individual patients. And when you're doing research or you're teaching medical students, it also matters to cohorts of people, not just a one-to-one benefit in medicine. But if your personality is anything like mine, and I will upfront admit that I'm probably way, way off my tree. I would probably call myself somebody who's always had a bit of an attention deficit disorder. I enjoy, on the one hand, going into the details of looking after patients and helping people to recover, and that is very satisfying. But on the other hand, I chafe at the limitations that such a career can impose on the way I think and the way I function. So, not to make too long a story of it, when I was a houseman and working 110 hours a week, doing a lot of scut work like taking bloods and running ECGs and collecting stool specimens and things like that, I discovered at that point that, I really didn't think that medicine was something I wanted to be immersed in as the only commitment as a lifelong career. That is the reason why after my housemanship, I went to national service, finished my national service as a doctor in the SAF, and then jumped into a medical military career. The military was very kind to me. SAF was very kind to me because they gave me the opportunity to train both in my specialty, which was gastroenterology and internal medicine. But very interestingly, they also gave me another specialty, which now many years later I'm able to talk about. And that was, I was probably Singapore's very first medical expert in treating chemical warfare injuries. You've heard in recent times about Novichok. You've heard about VX, agents of nerve gas agents that have been used to murder various people or attempt to murder various people even nowadays. And it's exactly that kind of injuries that I was trained to identify and to treat. But more important than that, my experience with the military gave me an education that a medical course or a career purely in clinical medicine would not have given me. And these were experiences in how to manage people in teams, how to run projects, about logistics, about expeditions, about organization, about administration. I was, even at that junior level, only 2 steps away from the Chief of Defense Force and 3 steps away from the Minister of Defense. So I had a large role in crafting medical policies for the SAF. So that taught me a lot about how large administrative organizations work as well. So if you combined my exposure to large organizations, some more bureaucratic than others, and my experiences through the military of doing more than just seeing patients, you sort of get a sense of how I've managed to use my medical knowledge and experience as a window into a variety of other experiences, some of which are very related, for example, disaster relief projects all over the place, as well as medical development projects in third world countries. So these are largely related, but also less related things. For example, I chair the Lien Center for Social Innovation, which is an agency that is a think and do tank, we like to call it, because we think of how society's unmet needs can be solved by innovative approaches upstream from simply providing goods and services at the end user level. So this is what I do as chairman of the board and guiding this organization. Then I also work with a large number of the committees as well as boards on a voluntary basis. For example, I work as an independent director of the UBS Optimus Foundation Singapore, and apply my expertise in social innovation to help them to create as well as to make grants for various projects around the world. I also work partly related to the medical field by sitting on the board of the Tan Tock Seng Hospital Community Fund, which has a lot to do with granting experimental and research projects to improve healthcare on a broad basis, systemic basis, not just clinical basis. And in that way, I do feel I'm contributing to larger numbers of patients all at one go. And I've just accepted another board position with the National Health Group Fund, which is a very large developmental fund, which will delve into not only patient care, but also innovative approaches to healthcare, the whole paradigm of healthcare and how we can improve it. So these are sort of medically related projects, quite apart from the non-medically related ones. Then talking about government, well, apart from being a civil servant with Ministry of Health at one point in time and working for the Ministry of Defense as a regular medical officer, I've also been for 18 years an elected member of the Singapore Medical Council, which is a statutory board that does regulation for ethics as well as discipline of doctors. And over 18 years, I had a large role in helping to craft different regulatory policies that govern the medical profession. And my last big project before I retired from the Medical Council was to chair the committee that rewrote the entire ethical code and guidelines for Singapore doctors to practice under. So that project was under the belt by the end of 2016. After that, to be honest, I was thoroughly exhausted, so I decided to step down and not be a member of the council anymore. But they seem to have kept me on as the chairman of the Medical Ethics Committee for the second term into my fourth year now, after I even left the council. I'll stop here because you can ask me specific questions if you're interested, but I just wanted to give you a sense that being a medically trained person can, if you are so inclined, lead you very deep and very intensely into the profession, which is wonderful if that's your thing. But it can also provide you the opportunity to open windows to a variety of different experiences and contribute to society in a number of different and varied ways, both locally as well as internationally. So I just wanted to open that up for discussion. Thank you.
Wow, thank you so much, Dr. Tan. You really have covered a lot there. So mentees, if you have any questions relating to what Dr. Tan has shared, please do share them. It'll be great if you can turn on your video and ask a question live. If you're a bit shy, you can ask it on the chat. Maybe Dr. Tan, can I just ask you one question? So for someone who is finishing a nursing degree or a medical degree now, what are some things that you would, what is some advice that you would give them to focus on as they look for their first role?
These are professional qualifications that you're talking about. As you know, there are many general degrees such as arts or science or, a variety of other more general degrees, for example, in business management and so forth, where you could either go into an area related to what you're trained in through that degree. But more generally, you are applicable to a lot of different careers, right? If you go into a professional course such as medicine or nursing or pharmacology or microbiology or biochemistry, it is much more specialized. So you have to think, first of all, are you in the right place? If you're in a clinical line, do you really enjoy patients as your first consideration? I know someone who was made to do medicine by his parents, and he gave it a go. He finished his MBBS, then he tried very hard to become a specialist, got his higher degrees, and went on to become a trainee, a resident in cardiology. Just a year before he fully qualified as a fully fledged cardiologist and would have been a consultant and launched a career in cardiology, he thought to himself, I really don't like this. I've tried very, very hard, and this is just not for me. He quit. He left the profession. He left the country, maybe to escape his parents, I don't know. And he started up a brand new career in finance. He was a brilliant computer programmer as a hobby, and he turned that into an ability to write programs for investing in futures. And he ran a fund. And he was quite successful in doing that as a second career. He did start late. Perhaps he might have had a nicer runway if he started early and realized it much earlier on that he didn't like clinical medicine. But at least he finally got to do something that he had always loved instead of being forced to be a doctor. So if you're going to go into a clinical field and you are already in a clinical course, then you really have to think about whether or not you believe this is the right thing for you. For medical and nursing students, you get a chance to find out because very quickly in your course, you will encounter patients in the wards, in the clinics, and you start learning from your seniors what it's like to be a practicing nurse or a doctor, right? So you get a sense of it. And if you discover that it is wrong, you're not fit for it, you don't like it, do you give it up, or do you then treat the rest of your course as a mental training ground to equip you with enough thinking skills through what you're learning, and yet have acquired a certain amount of knowledge of a certain kind in order for you to be able to launch into something different, maybe related to medicine, going into industry, going into management, going into an entrepreneurial line, or perhaps doing something different altogether, but just using your training as sort of like mental training and general capabilities training before you launch out. So these are some of the thoughts that you might have as you're going through your training at the moment if you haven't graduated yet, to decide whether you want to go into your career deeply, more widely, or out of it, or peripherally. I think these are some thoughts that you might have for yourself. Thanks.
Great. Thank you, Dr. Tan. So does anyone have any questions that you'd like to ask Dr. Tan? Oh, someone has asked.
There are lots of panelists. Please don't just ask me all the questions. There's so much richness going around.
Yes, okay. So actually, HS has asked a question to everyone on the panel. So HS, the question for everyone on the panel, I've heard that if you don't have a medical degree, it will be difficult to succeed in a hospital setting as you won't be respected by doctors. Do you believe this is true? So this is for everyone on the panel. Sophie, would you like to start maybe?
That is an extremely valid question. I had the same question before I entered healthcare. So I spoke to quite a number of people, people who would become my colleagues going forward. And the very short answer is no, it does, of course, having a medical degree does help because you would understand the terminology for one. You would also understand the concerns of doctors. You would be able to see from the perspective of, say someone like Dr. Tan, right? Say you are working with him in a hospital and you are on an administrative side. You would understand his perspective a lot better. So yes, undoubtedly there is an advantage if you have a medical degree. That being said, it doesn't disadvantage you if you don't, because number one, there are many different roles that you can still play. And number two, you can pick up along the way what you need in order to interact with the doctors, in order to, as what you, I think your question was whether or not will you be respected by the doctors. I think you can earn the respect if you have the passion. So you pick up what you need to learn, you pick up the terms in order to do your job well. And I think from Dr. Tan's perspective, he's probably can also share when he's worked with people in the hospital that are not in the medical field, that he can probably work well with quite a number of them as well. So short answer is no, it wouldn't disadvantage you.
Can I expand a little bit on that by saying that that question cuts both ways? Way back when Lee Kuan Yew was our prime minister, he used to say quite publicly, in fact, that he had a lot of brilliant friends and classmates who might have been drawn into politics and been made ministers because they're such brilliant people and they're such capable people that he might have wanted to invite them into politics and become ministers. And then he said this, but some of them became doctors and became so narrow that they were lost to public service. So by this, what Lee Kuan Yew was saying was exactly what I said earlier on, that if you're going to be a very a doctor who's going very deep into your profession, you might not actually acquire the breadth of thinking and the ability to have helicopter vision sufficiently to participate in broad policy building or running organizations or being in senior management. I'm not sure that's entirely true. I think it was a prejudice of Lee Kuan Yew in those days. But when I say that the question cuts both ways, it is this. Doctors don't necessarily make good administrators and managers. It's not automatic. It is not in the training of the medical school to allow you to experience or to learn how to be a good administrator or a manager, right? So a doctor has to work quite hard to acquire a lot of these skills through their early careers in order to be able to do this. And Ministry of Health actually has a program for clinician managers, and they will train doctors who wish to enter the managerial line, either to work as a management in hospitals or as management in the Ministry of Health, in fact. They will train you, to give you appropriate postings, put you through management courses and so forth, in order for you to acquire the skills. So it's not impossible for a doctor to learn. Equally, for a non-doctor to function effectively as, say, a CEO of a hospital, it's also a very steep learning curve, because you actually have to come to grips with a lot of technical stuff about medicine. And then you have to learn how to relate to patients, and you have to learn how to relate to doctors. And of all of that, the hardest job of all is to relate to the doctors. Doctors are very difficult people sometimes, as Sophie might tell you.
I could tell you that too, you know.
Yes. So I would say that the non-doctors whom I've had the pleasure of working with, who have been senior management or CEOs, the best of them would be those who are humble enough to try and learn what it takes to interact well with patients and doctors and to understand our problems, even though they themselves are not medically trained. These will gain our respect because they try. The worst of the lot will be those who are arrogant and think that because I'm a Harvard Business School grad, I will rule over all of you because you're just cogs in my wheel, right? And they don't have the humility to realize that just because you're a hotshot management guru, that you may not succeed unless you actually try very hard to understand what's happening in the profession and at ground level. Thanks.
That's great advice from Dr. Tan and from Sophie, right? So it cuts both ways. It's just always be humble, right? Whichever side you start from, wherever you start from, be humble and be open to learning and recognize that different people have different experiences, and you also bring valuable experiences to the table, regardless of the letters after your name. Yeah. Okay, we have another question, and this will actually be a good question for Arun. This is from Nikita. Nikita, actually, you are on video. Do you want to ask the question live?
Yeah, sure. So I guess this question is mainly for Arun, but feel free for whoever to chip in as well. So I'm interested to find out more about the healthcare startup scene in Singapore. And what are the different arms of a startup company? So like, what are some different roles that people play in a startup company? Because I've heard that the smaller the company, the breadth of the roles that a single person undertakes can expand quite a bit. So yeah, I'm just curious to find out more about that. Thank you.
Absolutely, and I think it's a great question in the sense that's much more relevant for someone coming out to say, should I take on a corporate role, or I'm not ready to start a new company on my own, but are there opportunities in smaller companies where I could make an oversized impact with my ability? So I think that's a very valid pathway for someone young like yourself. So what opportunities exist in Singapore? So Singapore has, if you look at it, there's lots of incentives, and there are incubators. If you are part of the NTU or NUS, there are Intuitive, there are MedTech specific incubators that give you really, what does it really take to do your own, start your own company? That's again, if you want to take that route, you can pair up with an alum, or if you are part of these institutions, you have access to their incubator services. What they do is they get you, how do you really do this unmet need analysis? So first of all, an entrepreneur exists. I'm going to go to entrepreneur and then go for a small company, in a basically career in a small company. An entrepreneur exists to fulfill an unmet need. So to get to an unmet need, you have to talk to a lot of people, understand what the problem you're going to solve. And sometimes you start with something, then you figure out that's not what I wanted to do. You can pivot later. But the principles of understanding an unmet need, and I'm going to fulfill that need, that's really what you should focus on, which means keeping your eyes and ears open all the time, not just be narrowly focused. Look around, ask people, don't be afraid of asking stupid questions. There are no stupid questions when you're an entrepreneur. Develop a thick skin, because sometimes you'll be like, you know what, you don't know. I mean, don't even talk to me. I'll give you 2 minutes, get it out. And then, all these things, these are part of growing up, to really learn how to understand what does it take to find out that. Once you find out that, this industry is also very difficult in terms of getting your product out to the market. Sanjay mentioned, Hologic is a fantastic company that in women's health, but every company that goes in the MedTech space have to go through a steep regulatory approval, because every product, every solution that we get to the consumers, the patients, this is actually needs to be regulated by the regulator. And that's not an easy thing, because you have to really go through a series of processes and testing. I'll skip the complexity, but it's not as easy as opening a website and doing something. If you want to get a device to market, stringent quality control process, quality management processes, regulatory approvals, that's one part of it. Then you add a layer on top, clinical acceptance. You may have built the best product, you can get it cleared through regulatory approval, but if the clinician says, you know what, I don't want to use it, that's completely useless. So which means you have to get the clinicians buy-in as a stakeholder as part of your process, right? Okay, so then you say, I've got the clinician to check in, I've got the regulatory clinical approval, I've got the unmet need, but if you don't have a big market for it, for example, who's going to pay for it, right? You can build so there are actually examples where somebody built a wonderful, fantastic product as a crutch after someone goes through an orthopedic surgery, but that crutch was priced 5 times more expensive than a normal one, right? So then you have to look at, where do I position it? Where's the market for it, right? So MedTech or health tech would challenge you all of these different steps. So you got to really find out how to navigate this complex world, but you don't do it alone. You do it with experts, you do it with people as part of your team. So that's if you're taking the entrepreneurial route, right? Singapore. So Singapore actually, plus and minus, so Singapore has good healthcare system. So I think if you want to innovate on a digital health, for example, hey, there's a mental health is a big problem in Singapore. Or for example, preparedness for kind of telemedicine. So Singapore is aging, the population is aging, and we don't want the seniors to come to a hospital. Sometimes hospital is a very dangerous place to come in because that's where you get all the infection and everything else. So you want to keep people at home, but care for them, right? You want to see the resilience of how people can cope with pandemics like this, right? There's lots of opportunities. Though Singapore has got a very good healthcare system, there are still opportunities in Singapore to make an impact and solve some of these problems. Because Singapore will get expensive. It's going to, as more and more people are aging, the cost of supporting that aging population is going to be increased. You can't simply tax your way or pay your way through that. So you got to innovate, right? Lots of companies in Singapore are addressing some of this home health. They're innovating in the seniors, taking care of the seniors. Smaller things like innovating diabetes or management, innovating chronic disease. So chronic disease is another big issue. Not going into depth. Chronic disease is someone who will not die basically from a chronic disease like asthma or diabetes, but it takes a constant effort to manage. Combination of medication, combination of lifestyle change, combination of innovations leading how to have a good quality of life. Lots of factors are there, but that's Singapore ecosystem offers a good pockets of case studies to say if you want to innovate in some areas, there are these opportunities available. But so that's the positive part. The flip side is Singapore is a very small market. That's a case in point for us. So we are into large open surgeries where volume is enough. Singapore, the population of 5 million people, and most of it is fewer surgeries. We don't scale in Singapore. So the position of Singapore is where you try things out, you pilot it. And I've been to many sessions where clinicians come, they are very excited. So I'm actually going to give I gave a talk to Temasek Polytechnic yesterday as part of a medical device course as well. And also I'm going to address a lot of clinicians in about a couple of months. So clinicians in Singapore are an interested bunch. On one hand, they have lots of things on their plate, but on the other hand, they are always curious. They also want to help. If you want really to talk to a clinician, it's not difficult to talk to a clinician in Singapore. And there are different clusters, like Dr. Tan is in on the National Healthcare Group. There are 3 major clusters in Singapore. They all have their innovation outreach. And you see, they all want to encourage and promote. If you have an idea, if you want to do something, they will help you manage and connect you with other entrepreneurs, depending on whatever stage you want to go. So in summary, I think what Singapore offers is a smaller, self-contained place where you can experiment with different ideas relatively easily. You can do. You can try out concepts. You can try out some of these pilots ideas, but always have to think about the global perspective. But in Singapore, it's self-contained. Lots of support available in terms of monetary support and mentoring support available in Singapore. But I would say it's a great place for someone to start. But I think they have to learn how to fly out of the nest as well. This is a safe nest for you to prepare yourself, but this can't be your home forever. That's what I would say. Yeah, I can talk to you offline about other things. In the interest of time, I'll just leave these key messages here.
Maybe I'll just add on to what Arun is saying, so Nikita, to answer your question and slightly adding something more. I mean, Arun has more experience clearly in the startup versus someone like me in the corporate. But over the last 3, 4, 5 years, I've seen more of the startup scene in Singapore really getting vibrant. So if you're looking at saying, look, I'm graduating out, where do I go? What do I look for? You need to look for those incubators. So there are not very far from the NUS, there are a lot of these areas where they're all hidden there. Block 23 or what is it? Block 23? Yeah. So there are
9, whatever.
71.
That's right. That's right. So block 71. Sorry. Yeah. So block 71. Right. So you just walk in there and just walk the corridors of there, knock on the doors, and you'll find that there's somebody interested in what you have. Now, again, you go to see what is that they bring in or what are they looking for, right? So clearly If you look at your area of expertise, you may find somebody in that area doing some work possible. If you're not in that area where they are, then they're looking for some skills that will help them. So I have a colleague of mine, previous colleague, who's a startup. Now she's looking for people who are coding and doing other things, may not be as much on the science, but more on the software side of coding and building and doing things on the health tech side. So I'm sure as you talk to Adeline, she can tell you there are maybe she's looking at people with some psychology background for something there. I'm just making up, right? So you'll have to figure out of your area of interest and what are those startups out there. But if you look back today, there is more happening here in Singapore that gives you a chance to enter in an organization, which is a very fledgling thing. And you ask the question, what all you're supposed to do? It could be from making coffee to doing the most innovative thing in the day, right? And I'm sure Arun does it. That's the fun of the role that he has, right? In my kind of an organization structure, you tend to get a little hierarchical. It's a large structure, all that thing. Now, there's a certain charm that comes with it. There's also certain learning that because you're very narrow in your learning. It's almost like Dr. Tan said, you get specialized. If you're a sales rep, you'll be a sales rep and you'll move up the career. Your regulatory person is regulatory. But if you go to a startup like Arun's, you're most probably going to get exposed in a day from regulatory to finance to accounting to making the coffee, the best coffee on the place. Would that be fair, Arun?
Absolutely. In fact, I have written clinical study protocols and I've conducted animal studies and I've actually been trained to do animal research. Just imagine, I'm an engineer. I was so allergic to even injections in my life. I have actually done animal studies myself, hands-on, right? All in a part of the day, right? You have to really, as an entrepreneur, that's a fun. When we attract people, we say, look, you don't expect the same day every day. That's the charm of it. But if people are looking for structure and really black and white, I think a startup may not be the right place. You got to be open, willing to learn. Learning is every day, right? Shades of gray are there every day. But I think it's a fulfilling thing. Spend a few years, I think you will be well-rounded. Then when you go and talk to likes of Sanjay to say, look, I've done this, then your pathways open up to multiple things. Like Sanjay, I started doing.
No, it is, and we're just going to make this into a little conversation to just build it on, right? So sometimes, I know some of you may have this question also, like, well, how do I get into a company? Because the companies don't hire freshers.
Mm-hmm.
There's always a dilemma, right? You go on one side, every company says, I want people with experience. Well, how do you get experience if you can't even get into your first role? So this is always a challenge. Why do companies want experience? Because they don't want to spend the time investing in training, developing and saying, this is a product, this is the market, this is how a doctor is. They say, look, can I get someone ready-made? So 1 year, 2 year, 3 years experience, right? Sometimes you can bring that experience through another way, which is through going into a startup, right? That gives you a chance to show that experience. And I've seen in my course of my career, when I've interviewed someone who's had that experience, some of them have done a corporate ladder, went out, did a startup, and then they came back, they became better leaders. Mm-hmm. Because they flexed themselves very differently in both ways. They had a structure and then they went completely the other route, right? And now they come back with the combination of strength and process and all those things, which is good, discipline they had. And now they also have the ability to think differently. So execution and innovation both kind of start coming together. So just be thinking like that. And again, you'll have to walk the corridors or find out through the NUS network and all, how is it that you can reach these startups? And then start corresponding and somebody will be interested in your area of expertise.
Trust me, one more point. People are always looking for talent in the startup world. If you think that, oh my God, who is going to hire me? I know a lot of my fellow startup founders, we're all looking for talent. The biggest challenge we have is Sanjay can easily get talent. Sophie can easily get talent. We cannot get talent that easily because nobody will want to take the risk. But if they take the risk and come, the rewards will be really there. And we can't pay as much as they pay. That's also a fact of life. But that's the trade-off you need to make. Yeah.
Great. Thank you so much. Actually, mentors, let's also put our contact details in the chat in case people want to follow up with us on any specific on any of these questions. And Nikita, feel free to reach out to Arun, reach out to myself or Sanjay, actually any of us, right? Any questions there? Aishwarya, you have a question for the panel. Go ahead, please.
Yes, that's right. I'm very interested in doing like international humanitarian work. So I was wondering, where do I like
And yeah.
Shall I try and take
Yes.
that?
Yes, please.
Yes, please.
Well, I think it's marvelous and wonderful that you want to do international humanitarian work. But we have to be a bit practical about it in some ways and be very clear about what it is that you can contribute. There are many organizations that do general humanitarian work, and I would include in these organizations like Red Cross, Singapore Red Cross Society, and Mercy Relief Singapore. Mercy Relief Singapore. These are organizations that look to see where they can help in international disasters, and they have a great need for generalists. Generalists meaning people who don't have any particular specialist skill and whom they can call upon to help to, say, raise money, help to pack goods, travel overseas, and help to distribute materials to people who are in need, or do general logistics as part of the support structure of an expedition. So these actually are very valuable roles, and through that, you could actually gain experience in how these projects and expeditions are put together, what goes into the knowledge gathering, the reconnaissance, the networking required, the partnership building with non-profit organizations or equivalent agencies in the foreign country where you're going to work. And you learn a lot of very general skills. And through that, you would be able to get further into the field of international humanitarian work and ultimately one day perhaps aim to be an organizer and a leader in such projects. The other route, of course, is through specialist contributions. And by that, I mean skills that may be very specifically required. For example, you might be a water engineer, and you would have the skills required to help put together the materials, the machines, and whatever is necessary to bring to a disaster zone, to set up and to operate and to give fresh water to people who may no longer have fresh water supplies due to a disaster. You notice I didn't start by talking about doctors and nurses because that's just so darn obvious. But there are other areas in which you can contribute. You could, for example, be involved in chemical engineering, in which if there is a disaster that involves chemicals, you would be able to contribute specifically to how you can resolve that issue. So if you go in as a specialist contributor, that is obviously very valuable. And through that route, you would also gain experience in all the things that are necessary to put together an expedition yourself. And in that way, one of these days, yourself become a leader of such projects. The way I went into it, of course, I started in the SAF. And very soon after I became a regular, I was asked to really deep end, I have to say, because in 1990, there was a massive earthquake in Baguio in the north of the Philippines. I don't know if anybody remembers that. Maybe some of you weren't even born, I'm not sure. But in 1990, there was this big disaster. And there was an international call for help. And Singapore volunteered the SAF Medical Services. And the SAF Medical Services looked around, saw who they had available and said, you, pointed at me, and said, you're a doctor. You're into the military operational aspects of medical support in warfare. Why don't you, adapt all of this and run a project for us? So truly deep end, with the help of a lot of people and good people on my team, we ran a very successful mission and spent 3 weeks in Baguio setting up a field medical and surgical unit in tents, living outdoors in a monsoon, and driving around the place, running mobile clinics as well. So that was one of my early experiences in disaster relief. And it was a joke that just before we finished that project, we had a radio message, and in those days it really was satellite. We didn't have this 4G and all that. And the message was, "Hey team, Saddam Hussein has just invaded Kuwait. Guess what? you're not coming home on the Charlie 130. We're flying you straight out to the Middle East to go and deal with that situation. And we all laughed about it heartily, of course, haha, sure. And, the last laugh was on us because this team came home. And within months of that, the Singapore government had committed to helping Operation Desert Storm and being part of the global coalition of forces to try and take back Kuwait from Saddam Hussein. And because we didn't want to be part of the war effort, the government cleverly said, let's make it humanitarian and send a medical team to join the British Forces Middle East so that we can contribute in a meaningful way and yet not be seen to be combatants in a battlefield, right? Diplomatically, that was easier to manage. Guess what? They looked around, looked to see who was available and who might possibly do it and said, why don't you go and put this team together and fly out to Saudi Arabia? And so we did. A team of 30 of us sat in desert sands in the winter of 1991, some 300 kilometers away from the front line, as it were. And we thought, therefore, maybe relatively safe while the air war was going on. What we didn't calculate was that Saddam Hussein's Scud missiles had an optimum range of, guess what, 300 kilometers from the front line. So we were prime targets for Scud missiles flying every single night and had to grab our gas masks and suits and everything and dive into shelters on a nightly basis as soon as all the alarms went off. So you can imagine this kind of deep end experiences forced me and my colleagues to really come up to speed very quickly how to do these things well, how to adapt quickly in uncertain situations, how to function as doctors and nurses in very uncertain environments where in fact your life could well be in danger from the next Scud missile. And I would say that coming from that kind of background, running a disaster relief project for, say, Pakistan earthquake or Typhoon Haiyan in the Philippines or an earthquake in Jakarta seems a little bit more like a walk in the park, not to minimize the actual work that goes into it. But, having come from major disasters run by the military, it really put us in good stead to be able to do this. So this is the way I got into it. And I started running not just projects run by Red Cross or Mercy Relief as a volunteer, but I also did a lot of freelance projects and partnered ourselves with non-governmental organizations that we networked with in foreign countries in order to do the work. There are lots of principles in which you can do this kind of work well, and if you're very interested, we can have a separate chat. But one of the key principles is that for this to be a successful project, you have to have a very good local partner that will not only give you access and help with logistics, but also work with you and take over the project when you leave, so that you're not a hit and run operation and you leave something useful behind. I hope that helps.
Thank you, Mr. Tan. That was very insightful. Thank you.
Good job, Aishwarya, asking the question. Sounds very exciting. If you'd like to go to the Middle East at short notice or Jakarta at short notice, that's your field. A question for Sophie that was asked around private sector. So careers in private sector. What kinds of careers are available in large private sector employers like Parkway for fresh graduates?
Okay, this one I will probably talk more along the non-medical, non-clinical roles. So I'll use the example of Parkway at least, and I think at least in the provider space, I think for medical devices, that one will be also another whole big range of roles there. So in a provider group, you have the way that we operate at least. We have verticals, so that would be operating entities like the hospitals, clinics, etc. We also have the horizontals, what is known as the corporate functions. So corporate functions, every company has. So for example, HR, marketing, finance. So similarly, we also have these functions that cut across the entire group. Verticals. So let's go into a bit more specifics. Say in a hospital, I'll kind of follow a patient journey. So when you step into the hospital, the first people that greet you is the front office. So front office staff would be more of a service element. So you need to be good in dealing and in interfacing with patients, with visitors, with family or patients. So front office is one. You go to the admissions office, that's known as the business office. So business office handles registration of patients, handles collection of payments, handles pretty much all the finance aspects of your stay in the hospital. And then you move it, you have after you go in from the admissions, you go to the wards. So at the wards, if you think about it, on the way there, you have people that take care of environmental services, meaning the landscaping of the hospital, the cleanliness of the hospital. In these days, extremely important, because these are the guys that make sure that your infection rates of infection are low. They come in and they are very familiar with the different types of infection control measures and the new technology. How do you sterilize a place that infectious disease might be in the area? You also have facilities management. So they're the guys that make sure that your fire alarm system is top notch. It's still working. I think you would have heard there were instances even in the past, even in Singapore, where there was some couple of fire emergencies, and in Singapore it didn't result in any, thankfully, in any fatalities or any injuries. But overseas, there are many reports of how fire emergencies have resulted in terrible consequences. So it is another area that is extremely important, fire safety, so facilities management. And then you go to the wards. You have, of course, the nurses. The nurses by far the backbone of the hospital, together with the doctors. And you also have, when you during your visit in the hospital, you would have F&B, so people that take care of your nutritional needs. So these handling a kitchen in the hospital is extremely different from handling a kitchen in any other place, because you need to think about your patient's dietary needs, the special needs that they need, as well as an added layer of, you want your patient to want to eat. You want to help your patient to have an appetite. If you eat well, you recover faster. So how do you balance the two? Because typically you know that, I mean, everyone has a perception that healthy food never tastes good. So you never have a good appetite in the hospital. But not having a good appetite actually hinders your recovery. So that's the challenge that our kitchen faces. And let me see if and you also have medical equipment. So the guys that take care of the medical equipment, engineering trained, and we have a group of administrators. So the operations team that would cut across all the different departments. They're pretty much a generalist of the hospital. You also have a service excellence team. So service excellence team that handles feedback from patients, feedback from visitors. Let me think. Yeah, I think that's pretty much the different functions in the hospital. You also have a marketing team that would handle both marketing of the hospital as well as interaction with the doctors. Yeah, I think that pretty much does cover most of it. Outside of the hospital setting, you have also quite a number of different types of roles. So for example, with a college, we have training and development for both our clinical and non-clinical staff. How do you train people to be to have a service mindset? How do you train people in infection control? We also have in the laboratory, we have technicians, lab technicians. In the radiology clinic, we have radiographers, radiologists. Yeah, I think that does cover most of the roles that would be hopefully of interest.
Are there management associate type programs, so where you rotate around to different functions? And Sanjay, Sanjay, Arun, if you also want to speak about your experience in Stryker and other companies. Sophie?
Yes, so we do have a management associate program. We revamp it every couple of years based on feedback from the people who are in the program. So I believe that the program as we speak is being revamped right now as well. But yes, we do have a management associate program, and it has proven quite successful over the years.
Sanjay? Oh, I think you may be on mute.
So, and I don't, in the US, generally, because it's a corporate headquarters, there's a lot more of this where there's rotation within the US. But in the region, we don't have more structure to say the management program, because it's a little more country based. So if you're based in China, there would be something within China we do, or within Australia, or within Japan. But there's not a lot of people that we move at junior levels among countries, given the size and scale of the organization. Now, I'll add on to what Sophie said. Right? There are many roles that come up. So there's definitely the sales and marketing, which is a large part of a commercial organization like ours. So these are the people who go out and make create the demand in the market and then fulfill the demand, are involved with competitive selling, you against a competition, and all those things that have to be done. But then there's also the support organization that comes with. There are people called application specialists. So their job is to train a physician, a technician, how to use the product that is brought into the hospital, right? So there's a machine, how do you handle it? What is the clinical way to look at it? What are all the do's and don'ts? So there's a part of the role that they play. There's also the service engineers, to what Sophie said, there's in-house engineers in the hospital. And then there's also companies that have engineers who are on site to take care of these problems. Most of the time when a hospital can't address it, it gets escalated to what is called the level 2 troubleshooting, because these are people who have more expertise on those products, right? You have the back office functions, right? So finance, typical all the finance accounting that is done. So how to do the billing, invoicing to a customer, how to collect the payment, that becomes the finance function. Supply chain, how to get the product from point A to point B. That is from a manufacturing site in one of these locations or abroad to a place where we store our products to the customer site. Right, so that's the whole supply chain, customer service that gets involved in. Regulatory, Arun called it out earlier, right? Regulatory is a critical function. Again, it comes up with bringing the products to the market. So engaging with the HSA in Singapore or other regulatory bodies across countries. So every vertical has different level of expertise that is demanded of the role. And then you find people. So as you are all looking at your careers, yes, everything is open for you. But again, you'll have to understand what excites you. Right. And sometimes you know what excites you, so you clearly can go in with that. So if you say, look, I like finance, well, hopefully you're studying finance. Because if you come to an interview with us and say, I want to do finance, and then we ask you, so what have you been studying? And you say, let's say aeronautical engineering, right? And I may laugh on that one, right? Or something like that. And, we ask you like, well, aeronautical engineering and finance, I mean, how does that work, right? Because somewhere you need statutory there's a statutory requirement that you know your finance. If not, we are giving the keys to the wrong person to run the organization. So things like that, you'll have to look at HSA, where you're regulatory, you need sometimes a pharmacist license or something equivalent like that. So just a few things. If you do a little of the homework, I think you'll find there are opportunities in many of the companies. And the larger the size of the company, the more deeper the roles they have. The slightly smaller companies, they will have more roles in country based, and Singapore generally is the regional headquarters. So in regional headquarters, you generally have the most senior roles. We call them overheads, if you understand the joke. These are the people who get paid a lot, but they don't do a lot, but they just get paid a lot, right? So that's kind of called overhead. But the real job happens in the country level, and that's where a lot of the action is happening. Arun, what add?
I mean, I think you've covered everything, Sanjay. So I think management. So I think if you want to enter a major multinational company or even a local regional company, chances are you're going to be spending a few years in the company. It's an investment of a year. So I think I would say it is better to join a bigger company with a little bit of an advanced education. So straight from a polytechnic or a bachelor's degree, join a company. It's okay, but I would rather say if you want to be a specialist, do another degree. So we haven't talked about next level of education for you guys. So if you look around, most of us have more than 1 or 2 degrees. So that is actually becomes a sort of a requirement as you grow up. It's not because we add titles behind the names, but I think the expertise or the exposure required. So I would also encourage, it's counterintuitive. We're talking about a career opportunity conversation, but also if you're seriously considering education, this is also a good time to talk about it as well. Entry-level careers will get you some way, but I think you want to grow in an organization, bigger organization, next level of degrees would be much preferred. I don't know, Sanjay, if I'm saying something counter to what you're saying. But
No, I mean, there are two views to this, right?
Yes.
So one is, it's somebody like, I'll take my own career. 4 years of engineering, I felt enough. I had enough.
Okay.
I want to go out and get some money and put some money in my pocket and then go out and have a beer and enjoy life a little, right? That was what I did. Now, I had my friends who went and did their MTech, and some even went and did their PhD, but they were clearly decided they wanted a route which was going to take them a career path like that. Now, today, I think Arun's point is very valid in a different context. Today, the world is competitive. So you're going to stand up and you come for an interview. Yes, you have someone who, let's say, who comes from a diploma background, a degree background, and then a master's or an undergrad and a grad, as we call them, right? You're going to give some weightage to somebody who comes with higher qualifications, but it does not always necessarily mean that they are the best person, right? Because there's again a fit to the role, as we say. So every job, there's a fit to the role. Some people are overqualified, some are underqualified, some are rightly qualified. So you'll also have to look at that in an aspect of where you come from, right? If not, you walk in and say, well, I've really done all these degrees, treat me with more consideration. We don't look at it that way. We look at it and say, what does the role demand? Because finally, we have to compensate you also accordingly. So I think that's kind of where maybe some of this come in. But Arun's point is valid. The world is competitive. Again, depends on which arenas you're going in. The more technically you're going in, the more I would say increase your education level. The more generic and role you're going into, sales and marketing doesn't need you to do a PhD, right? So let's be very clear about that. But sales and marketing needs you to have the good people skills.
Mm-hmm.
So if you're one of those who has a PhD in science, but doesn't like to talk to human beings, and then you say, I want to go into sales, it's a disaster, right? So I think it's just always, so that's why I think in colleges and schools, you're taught there is a strength, in a way, there's a strength finder exercise all of you do, which shows you what careers, what opportunities you may be most suitable to. It is not I don't know how valid the science is, but at least it gives you some idea. So my only advice to you is, if you don't know what you want, at least be clear what you don't want to do.
Yeah.
That much you can do the process of elimination, but then figure out what to get into.
Yeah.
Can I add a point about professional education? In places like Singapore, the medical school begins at the age of 18. Well, if you do NS, it's 21. But the point is that you're out of school and you go straight into a professional course and you graduate fairly young. There are other places like in the US, for example, where professional courses like medicine are graduate courses. You have to do a 3-year undergraduate degree first before you can even be considered for a professional course. And I think there is some advantage in that in some ways, because firstly, it gives the professional a broader base of education and enables them to understand more things about the world. If they've, for example, done a liberal science degree or liberal arts degree or something, it might actually make them better doctors or nurses in the future, because they just understand the world that much better. And then secondly, being more mature students and you graduate at a slightly older age. Yes, the night duties are harder because you're older, no doubt about that. But you're a more mature person, and you're able to interact with people better. You understand humanity better. So there are some advantages in this. So those of us who come through systems where the basic degrees are starting very young and you graduate and you're basically thrown into the deep end as a doctor by the time you're 23 or 24. It's a really steep learning curve to learn the other things in life that you need to learn. And it's a steep learning curve to develop the EQ you need to be a good doctor and to be a good everything else that you might be required to be doing as a doctor for the rest of your life. So I would actually say that if you're in a professional career right now, take every opportunity you can to expand and to learn other things. I'll give you a simple example. Doctors become very good surgeons and physicians through the public service hospitals. One day they dive into private practice and go and join myself and Sophie in Parkway Pantai, and they run their own clinics. And to their shock and horror, they have not even the first idea how to manage their clinic accounts and how to do stock taking for their pharmaceuticals, etc. And they are desperate for help. I like to joke sometimes that, doctors are doctors because we can't count. That is why it all stops at 2 pills 3 times a day, full stop.
That has to be a doctor joke,
Yeah, but if I can touch on one last point, the management in medical services and the professional aspects of medical services do have meetings of minds, in a sense that in all our restructured hospitals and in our private hospitals as well, you have management and you have the medical board. The management represents all the backbone structure of providing the services in all the respects, horizontal and vertical, that Sophie has so eloquently described. But the medical board gives the interface whereby patients' needs and what happens to the patient experience get translated by the management side into that experience. I mean, just to go back to a very simple example that Sophie gave, if our patients tell us that the food is inedible, we'll go to the medical board meetings together with senior management and say, we need to do something. The food is inedible. Our patients are not doing well. And that is where management then realizes that one of the verticals needs adjustment. And that's where they get the valuable inputs. Equally, on the professional side, we get the opportunity to understand some of the limitations and some of the issues that management faces. Some of them are policy, some of them are regulatory, some of them are legislative, some of them are human resource, et cetera, et cetera. And so in understanding how management tries to service patients and service ourselves, we come to a mutual understanding as to what is the best way to go forward, with some compromises that may be needed in order for the patient experience to be as good as possible and in their overall best interest. So this is to say that it's not a divide. It's not there's management and there's doctors. There are ways and means by which both parties will come together and work together for the common good. Thanks.
Great. Well, thank you so much. So I know we're over time. One last question for all our panelists. I think we've all heard that there are many, many different roles and there's no one career path. It really depends on your interest, on your aptitude and everything, right? So Sophie, Arun, Sanjay, Dr. Tan, if you were 24 years old again, what kind of organization or role would you be applying to? Or if you're going to start a company, what kind of company would you start and why? So this will give our mentees a flavor of what are some of the exciting opportunities that you see for young people in their shoes today. So who wants to start? Maybe Sophie?
Wow, if I was 24 again. It really is an amazing question, just because the options today are so broad. And back when I was 24, the startup environment was really not as vibrant as it is right now. So maybe if I had started work as a fresh grad in today's world, I would be quite interested actually to explore a startup, trying out what it's like in the start. Oh, hi there, little one.
Not 24 yet. Making her listen and plan ahead.
But yeah, I've always been extremely curious about what it's like to be in a startup, and I'll probably, if I had a chance, as a much younger person, try it out in a startup.
Any particular type of startup or field?
I think that the future is definitely in a startup that utilizes technology, for sure. Yeah, that is the future. Whether or not is it, and especially in the usage of data. So if it's a startup that can utilize data, it doesn't matter what industry you're in. It could be in healthcare, it could be in anything. That would be an extremely interesting career path to start on.
Fantastic. Great. Arun, from the startup world, if you're 24-year-old again today, what would you be doing? What would you be looking at?
So as Dr. Tan said, I think Sanjay and I, I got my first job before I turned 21. I started working before I turned 21, right? So engineers straight out doing this, it was more, I want to get out, I want to see some money, I want to, get that. Then I realized like, it was not, life is not taking me, in fact, Sanjay and I share the same starting point. So I was installing computers and fixing things for big banks while he was doing for big other medical device companies in the sense, Boehringer. So if I were 24 now, I would take risk. I was a little bit risk averse. I didn't experiment with my life at 24. I took that job and I felt comfortable working for a company and grew with it. I became an entrepreneur in my early 40s. So I would have taken risk and tried it. I would try now. I would take life a little bit easier. I was a little bit harsh on myself and I want to go too much it was partially peer pressure. Partially every one of my friends was sort of doing a job. I have to go to a job company. Either they were going doing a MS in the US or doing something. So I think I would take that risk and try a life out. Maybe if you want to travel, do something, you can make n number of mistakes. I think Singapore education system is a high performance, high pressure system. And I think you've all gone through this. It's my little bit pet peeve. I think it doesn't give you the freedom to take risks. And people who take the risks actually become better in lives and whatever they do. So you have to take the risk. If I were 24, follow your passion.
Yeah, don't do.
Want to do? Go be a chef or do whatever you want, right? Do 2-3 years. You'll somehow survive, even scrape through, but get that couple of years in your life and you can always catch up later. So that would be my advice. And if I were to do this, I would not go with the well-trodden path. I would take something different, do something different. Then I'll probably see what life takes me.
Okay, got it. And if you want to be a chef, consider being a chef in a hospital, right?
Whatever. So you can taste the food, bland food, but good food.
There you go. Okay, Sanjay, how about yourself? You were 24-year-old today.
So quite similar to stories that Arun said, and to somewhere I echo what Sophie also said, right? When we were graduating that time, the options were very limited. We were pigeonholed, right? It was not like there was a world out there and we could go and pick anything we chose. It was very few career paths, and you almost got into the rail track of that. A doctor, an engineer, an architect, kind of, that were the paths. 5 rail tracks led out, get onto one of them. If not, you're derailed. It was as simple as that, right? So today, if I look back, and again, I have no regrets on what the journey has been till now. So that's a different part. But if you flash back it and play it a different way around, I would say, and I echo Arun's point, right? This is the opportunity to try and fail, because the world gives you more options today to fail. And they don't treat you with so much of contempt when you fail, right? Secondly, most of you are living in some kind of a household with a roof over your head, and there are 3 meals coming your way. Your parents, someone is providing you with that in a way. So it's not like you're on the streets. You have no idea about your next meal. It's not that dire straits. So which means you have the ability to go out and try something different. So I would recommend is the career paths options are always there. For me, it would have been to look up and say, can I go and explore more about the startup where I can combine a purpose and the freedom to do more, right? And that is maybe what I would say is very different from where I started, which was a little more inward looking into corporate world, and then you get regimented out. But there also many of us learn to become entrepreneurs. Arun is an entrepreneur. He does it from the outside. I'm an entrepreneur. I do it from the inside using the ecosystem of a company or a corporation, right? So we have different ways of doing it, and you can get to similar goals of what makes you happy, what gets you content, but your world is bigger. Your failure rate can be higher. For us, failure meant a lot of challenges because our financial systems were not that great. Our family environments were not that great. Today, fast forward, my kids who are your age, they can afford to fail and do all the things they want. and still come home and live at home and have 3 meals, right? Although I would like to get them out of home as quick as possible, but that's a different story. Yeah.
Arun can cook for them the 3 meals.
That's it.
Okay. Dr. Tan, what would you do if you're 24?
Oh, wow. I think first I want to echo what Sanjay and Arun have also said, and Sophie as well, that when we think of a question like what you would do if you were 24 today, how you think about it is influenced massively by whether you have any regrets. And if you don't have any regrets, then it's actually harder to think what else you might want to do differently. Because if you were very satisfied with your trajectory, then that is your life experience. And I have to say that I have been fortunate in my career and in my experiences to have the opportunity to do a great number of things that I have enjoyed and that I found meaning in. But if you ask me what could be different about 24 today, well, look at my virtual background. Does anybody recognize it at all? Is anyone old enough to actually recognize this?
Is it a casino or something else like that?
Oh.
Is it the Tesla?
Tesla? No, it's nothing true to life. This is a television set of a science fiction serial that is the longest running science fiction serial in the entire universe as far as I know. It started in 1963 and it is still running in 2021.
Jeopardy.
No, science fiction. It's called Doctor Who. I don't know if anybody's ever heard of Doctor Who, but he is not a medical doctor. He calls himself a doctor of just about everything. And he has this machine that looks like this on the inside in 2019. It looked a bit different when it started in 1963. But the idea is that he's able to travel widely and freely through time and space, experiencing all sorts of things, interacting with all sorts of people and aliens, and basically doing good in the universe. Maybe I have such an affinity to this particular TV series, which I started watching when I was 4 years old in Singapore in black and white in 1963 or 64. And because, maybe subconsciously I have this great desire to travel through time and space and be as adventurous as possible. So if I had the opportunity again at the age of 24, maybe I wouldn't have limited my early experiences to being in Singapore. Maybe I would have decided to launch out and experience what life can be like as a doctor in a much larger place. And maybe there may have been opportunities that would have been different. I don't know if they would have been better or not, but maybe they would have been different from what I actually ended up doing in Singapore. But I do think that, just as Arun says, Singapore is a very small marketplace. It is a very small mind place as well. And, it's actually shockingly easy to be a big fish in a small pond, as opposed to, being a small fish in a big pond and trying to make your way and becoming that big fish in a much bigger universe. So I think, what would I do differently today? I would probably strike it out abroad and see where that takes me. That will be a massive adventure in that, I'm sure.
Great. Well, thank you so much for sharing all of this. I think our mentees got a lot out of this. They get to understand all the different facets of your personalities as well as your experiences that you shared today. And thank you so much for sharing your contact information. So mentees, as always, we're all here as mentors to help you and to answer any questions. A lot of these are one-on-one conversations when it comes to career. So please do feel free to reach out. And on behalf of everyone, I would like to thank our panelists, Dr. Tan, Sophie, Arun, Sanjay. So thank you so much for your time. Arun, were you going to say something?
I want to thank the mentees for giving us the opportunity to get to know the fellow mentors. Without them, I wouldn't have known. Look, I thoroughly enjoyed much more, I'm sure, than the mentees. So thank you, mentees, for making this. On your behalf, I got to know all my colleagues as well. Thank you.
I agree with that, Arun.
Yes,
it's been a wonderful
definitely.
opportunity. We don't get a chance to meet often enough in this COVID environment.
Yeah.
Yes. Great. Well, thank you everyone so much. Have a wonderful evening and we'll see you soon. Take care.
Yeah.
Bye.
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 Thank you. Have a great evening.
Bye.